Lisa Broyles here with Way to Health MD, and this is the next installment in my inflammation series, and today we're discussing the endocrine system. Your endocrine system is made up of your thyroid, which is regulated by your pituitary gland and the thyroid itself, and even all of your body tissues, as well as your hormones such as estrogen, progesterone, DHEA, and testosterone. So symptoms of chronic inflammation in your endocrine system include headaches, low mood, low libido, low energy, irregular periods or heavy periods for women, poor muscle mass. So these are just a few examples of endocrine dysfunction. So how does that happen? How do you get inflammation in the endocrine system? One of the biggest causes today is plastics exposure, microplastics, plastics in our food. So if you are drinking coffee from a Keurig, you are heating that plastic and getting plastic in that coffee. Any hot drinks that are in a plastic beverage, you should ideally avoid. Even drinks that you say buy from the gas station, you buy some water and you think, hey, it's cold, it's fine to get it from a plastic bottle. The problem is it probably sat in a warehouse and got hot before it was refrigerated at that gas station. So you need to ideally avoid drinking or eating from anything that's been in plastic. Unfortunately, plastics are inevitable because our food is wrapped in it, our cans are lined with it. It's in our salt from our oceans, so you can minimize it through trying to avoid food that is wrapped or stored in it, or certainly don't microwave food in plastic containers. And the reason for this is plastics are a xenoestrogen, meaning they mimic estrogen in our bodies. So for women, this makes women have too much estrogen and not enough progesterone. And this creates estrogen dominance type syndromes, such as PCOS, polycystic ovarian system, such as PMDD, which is basically really bad PMS dysphoric disorder, premenstrual dysphoric disorder. Also, things like breast cancer are related to chronic inflammation, and I'll give you a little breakdown into why. Estrogen in itself is not pro-breast cancer. You have three types of estrogen that the body makes: estrone, which is E1, estradiol, which is E2, and estriol, which is E3. So after women go through menopause, the body tends to produce mainly estrone, which is unfortunately the pro-breast cancer, pro-inflammatory type of estrogen. However, you can help your body regulate and keep your levels of estrone down by the way you live and your lifestyle and your plastics intake and the pesticides that you consume in your foods, because non-organic foods that are loaded with pesticides, unfortunately, those also mimic estrogen, further increasing the syndrome of too much estrogen in the body. For breast cancer, this is important because there's an enzyme that's naturally occurring in the gut called beta-glucuronidase, and that enzyme helps your liver to detox. However, that enzyme is also produced by unhealthy bacteria in our gut, such as E. coli and Clostridia, for example. So if you have an unhealthy gut, we talked about that in the earlier gut series, if you have too much of that pro-inflammatory bacteria in the gut that's producing the beta-glucuronidase, it will actually make your body turn more of its good estradiol that you want into the pro-inflammatory estrone that you don't want, that increases your risk of breast cancer. So I do test for beta-glucuronidase levels as part of my gut testing. I do recommend that if you are having any symptoms of an endocrine or a gut disorder, this is a standard part of what should be tested by your doctor. Most regular doctors probably don't even know what beta-glucuronidase is, but it is part of holistic labs such as the Genova GI-FX testing. So if beta-glucuronidase levels are high, then I tend to put my patients on a supplement called calcium D-glucarate. I usually use Designs for Health for that. They have a 1350 milligram supplement that's taken twice daily. This calcium D-glucarate lowers beta-glucuronidase levels, thereby lowering estrone levels and improving estradiol levels. I also fix the gut and I target whatever bacteria such as Clostridia or E. coli that's causing the beta-glucuronidase to be high in the first place, and I try to eradicate it with herbal therapies. So breast cancer, PCOS, PMDD, low testosterone for men, all of these are caused by chronic inflammation in the endocrine, in the gut, also Hashimoto's disease. Did you know that if you're sensitive to gluten, the genetically modified gluten mimics the thyroid, and when that gets into our bloodstream, the immune system reacts and says, hey, this gluten particle looks like the thyroid, and it attacks the thyroid. It's called molecular mimicry, and it's greatly increased the amount of Hashimoto's disease, which is an autoimmune hypothyroidism, all because we are eating genetically modified wheat when we shouldn't be, because our bodies don't know what to do with it. So these are just some examples of syndromes that develop from endocrine system chronic inflammation. So I hope this is helpful. I would love to talk to you more in person individually if any of this is relevant for you. Thank you.